Hello everyone, continuing our immunodeficiency disorders. So now we are going to talk about the combined B and T cell disorder. In the previous video we spoke about only B cell and then we spoke about only T cell dysfunction. As we know, we are aiming at filling this very table so that we have all the points at one place. So we will be discussing this mnemonic WASH, and which stands for WiskotAld, AtaxiaTelengectasia, SCID and hyper IgM. So the first is W. W stands for WiskotAld. Now in this particular table we have to remember the inheritances. So just remember one line, that all the four are X-linked recessive except AtaxiaTelengectasia. AtaxiaTelengectasia, A for A is the autosomal recessive. That is the only different point here. So let's start with the W, that is WiskotAld. So WiskotAld is easily remembered by the mnemonic TIRE. TIRE stands for thrombocytopenia, infections, eczema and recessive, that is X-linked recessive. So we've combined the clinical features. So this is done, and the mutation is in WASP gene. There's defective antigen presentation and it's an X-linked recessive disorder, as it's already done. And importantly, you need to remember the lab finding, which is a bit different, that here you have fewer and smaller platelets will be formed. And another important point, where do you find large platelets? This is also a question. So let me know in the comments the answer to this. So here, small platelets found here, and here you have to remember that there will be increased IgE and A. Okay, so we'll figure out how to remember this. So there's a TIRE mnemonic and WASP gene. Next is A. A is AtaxiaTelengectasia. A for A, it is autosomal recessive and it is on chromosome 11. Remember this because AtaxiaTelengectasia is frequently asked. So next they could probably ask is the chromosome in INI. So AtaxiaTelengectasia, autosomal recessive, defective NHEJ. So ATM gene is the mutated gene, and due to which there is a defect in the non-homologous end joining that results in a lot of accumulation of mutation. So because of failure to detect the DNA damage, there is no DNA repair. Hence you would have a lot of cancers as well, so increased risk of lymphoma and leukemia. Other than that, you need to remember that AtaxiaTelengectasia, in its name it says ataxia, hence there will be ataxia. This picture symbolizes the telangiectasias obviously, and we have IgA deficiencies. So remember the A's. In A's, like previous video, we have done it in selective IgA deficiency. AtaxiaTelengectasia also there are A's. So ataxia, angiomas, which are basic telangiectasias, and IgA deficiency. Right. Also, there will be increased sensitivity to radiation, hence you have to limit the X-ray exposure, because X-rays and these radiation induce DNA damage, induce DNA mutations, and in such patients they won't be able to repair these defects, hence the mutations will accumulate and the DNA damage will accumulate, which will be carcinogenic. Very, very important, you need to know ASA, also AFP. AFP. So the A's are autosomal recessive, ataxia, angiomas, AFP, and I used to remember it as the, if they ever ask you, they haven't asked yet, but potential question, that there is decrease in age, that is IgA, IgG and IgE. So we have done this, and this we already know, there is cerebral atrophy and lymphopenia. Then you have S. S stands for SCID. Now whenever SCID comes to my mind, I need to know that the most common form is X-linked recessive, which is due to defective IL-2 receptor gamma chain. It can also occur due to ADA mutation, that is adenosine deaminase mutation or RAG mutation. Now this is a previous year question which I've added, that the genes involved in SCID are JAK3, RAG1, IL7R. So some are mentioned, some are not. That's how you annotate your first aid and concise stuff. You add the previous year questions here itself. Right. So as you know, this is a bubble baby syndrome. There will be so many infections. The patient will be predisposed to a lot of infection as both B and T cell is gone. Also, just a thing to remember, cramp is that decreased TREX. Mainly the mutation has been asked till now, so you need to know that. So this is an important topic, so just read this, that thymus shadow will also not be present, and there will be no germinal centers also. Germinal centers were also absent in which one? X-linked A-gamma globulinemia. Okay, so next is WASH H. H is hyper IgM here. Now hyper IgM, the only thing that you need to remember is that IgM is an agglutinating antibody, hence because if IgM is more, it can also cause AIHA. So an immunodeficiency disorder which can cause AIH is hyper IgM. It is due to defective CD40L and TH cells. Hence, class switching won't be possible. It's a class switching defect and it will lead to severe infections. Again, just like your ataxia-telangiectasia, you have age here and you have age in hyper IgE as well. So that's how you just can remember this little point. These two are present together, right? Age and age. So now let's just concise these 4 disorders. A lot of to know about these disorders because much more frequently asked than your B cell and T cell individually. So let's go to this table, right? Wash mnemonic, WiskotAld. Remember only 2 points. First, you have to remember B and T cell all are X-linked recessive except A for A, ataxia-telangiectasia, which is autosomal recessive. The next point we've starting with WiskotAld, that the mnemonic is tired, thrombocytopenia, infection, eczema, and recessive. Apart from that, the lab findings of WiskotAld, lab findings will be increase in level of IgE and A. Okay, and another thing that there will be smaller platelets. After that, let's talk about ataxia-telangiectasia. You need to know all the A's. Let's do it just with the A's. So A is autosomal recessive, A is ATM gene, ATM which will lead to NHEJ defective. Okay. In A there is again ataxia, angiomas, and there is IgA deficiency. Now, because there's ATM gene and because the DNA repair mechanism doesn't function, hence it will lead to increased cancers, which will be lymphoma, leukemias. Another thing that you need to know is lab finding in which IgA, IgG, and IgE age. Right? Remember age. So in this ataxia-telangiectasia and this age finding that is decrease in all of these is common for this as well, hyper IgM as well. IgM will be increased here but these will be decreased. So this is a common finding for both. So you've done ataxia-telangiectasia with all the A's. Now let's move to SCID. In SCID you just need to remember the mutation, and the most common is an X-linked recessive mutation, that is an IL-2 receptor. Then others we already know ADA, which is an autosomal recessive mutation. We have the AG gene and the JAK3 mutation is also prevalent here. SCID, only this, apart from this just a point to remember, that is decreased TREC. Then we have hyper IgM. Just remember this is a basic micro point that M is agglutinating antibody, hence agglutination will be seen and it will lead to autoimmune hemolytic anemia, obviously cold type. Apart from this, decrease in IgM and decrease in A, G and E. So that will be another point that you need to know. So that is how we have finally combined all the B cell, T cell and B plus T cell. So if I had 5 minutes to see this topic of immunodeficiency, as it is very clinically important, probably will be asked in next, what would I do? I would keep this table in my last 10 days revision notebook and I would just all the time remember BT, B plus T, SACS, Tech 12 and WASH, and then I would just see the important points which are mentioned here. So the most important question that can be asked is in BNT, it is from thymic aplasia and it is from WiskotAld and ataxia-telangiectasia. These are the most important ones. Rest I just need to have a look with this table. So thank you.